What if I told you that heart surgeons see something alarming in nearly 100% of their patients, something that most doctors never discuss with their patients? I recently spoke with a renowned cardiovascular surgeon, Dr. James Mitchell, who revealed a startling truth. In my 25 years of performing open-heart surgeries, there's one consistent finding I see in almost every patient: a specific type of fat that literally wraps around the heart like a dangerous blanket. This isn't just any fat. What makes this discovery so concerning is that this particular fat, called epicardial fat, directly contacts your heart muscle and coronary arteries. Unlike fat elsewhere in your body, there's no protective barrier between this fat and your heart. The inflammatory compounds released from this fat tissue go straight into your heart tissue and blood vessels, creating the perfect storm for heart disease. But here's what's truly shocking. Most people focusing on heart health have never even heard about this critical factor. They're busy worrying about cholesterol numbers while completely missing what might be the actual #1 cause of heart disease. 1. The surprising root causes modern medicine overlooks. So what actually causes insulin resistance in the first place? The standard answer you'll hear focuses exclusively on sugar and refined carbohydrates. And yes, excessive consumption of these foods absolutely contributes to the problem. Every time you consume foods that rapidly spike blood sugar, like bread, pasta, cereals, and especially sugar-sweetened beverages, your pancreas must release a surge of insulin. Over time, these repeated insulin spikes can desensitize your cell's insulin receptors. It's like constantly shouting at someone. Eventually, they'll start tuning you out. The same happens with your cells and insulin, but there's another critical factor that few health professionals discuss: chronic stress. When you're constantly stressed, your body releases cortisol, which directly interferes with insulin sensitivity. This explains why even people following perfect diets can develop insulin resistance if they're chronically stressed or sleep-deprived. Speaking of sleep, poor sleep quality is another major contributor. Just one night of inadequate sleep can reduce insulin sensitivity by up to 25%. If you have untreated sleep apnea, you're at particularly high risk. 2. The dangerous ingredient, hiding in healthy foods. But there's one more crucial factor that might be the most overlooked cause of insulin resistance and heart disease: industrial seed oils. Yes, the very oils that have been marketed as heart-healthy for decades. I'm talking about soybean oil, corn oil, canola oil, sunflower oil, safflower oil, and other vegetable oils that have become ubiquitous in our food supply. These oils are found in virtually every processed food, from salad dressings to healthy plant-based meat alternatives. What makes these oils so problematic? First, they're extraordinarily high in omega-6 fatty acids. While we need some omega-6 in our diet, the average American consumes these fats in quantities 10 to 20 times higher than evolutionary norms. This creates a profound imbalance that promotes inflammation throughout the body. But the bigger issue is how these oils are produced. Industrial seed oils undergo extensive processing at high temperatures, often with chemical solvents like hexane. Yes, the same compound found in gasoline. This processing creates oxidized byproducts and trans fats that directly damage cell membranes, including the membranes where insulin receptors are located. When these damaged fats get incorporated into your cell membranes, the insulin receptors don't function properly. It's like trying to unlock a door with a key that no longer fits because the lock has been damaged. What's particularly concerning is that these oxidized fats can remain in your cell membranes for up to 18 months. This explains why some people don't see immediate improvements when changing their diet. The damage from previous consumption continues affecting their metabolism. The average American now gets 25 to 30% of their daily calories from these industrial seed oils, a substance that barely existed in the human diet before 1900. Is it any coincidence that heart disease rates have skyrocketed during the same period these oils became dietary staples? 3. Why your heart-healthy diet might actually be harming your heart. This brings us to an important realization. Many people diligently following supposedly heart-healthy diets may actually be worsening their condition without realizing it. Consider someone who eliminates red meat and eggs based on outdated cholesterol fears, then replaces these nutrient-dense foods with healthy whole grains and vegetable oils. They might be inadvertently creating the perfect metabolic storm for insulin resistance and epicardial fat accumulation. Even people following low-carb or ketogenic diets can fall into this trap. They meticulously count carbs while liberally consuming seed oils in the form of commercial salad dressings, mayonnaise, or restaurant foods. They experience some benefits from carb reduction, but wonder why their inflammation markers remain elevated, or why they still have stubborn fat that won't budge. The solution isn't just about going low carb. It's about embracing what I call a clean keto approach. This means focusing on whole, unprocessed foods while being equally vigilant about eliminating industrial seed oils as you are about limiting carbohydrates. Instead of seed oils, use traditional cooking fats that humans have consumed for thousands of years: butter, ghee, tallow, lard, coconut oil, and olive oil. These fats provide stable fatty acids that support cell membrane integrity rather than damaging it. 4. Step protocol to eliminate dangerous heart fat. Now for the good news. Epicardial fat responds remarkably well to the right interventions. Unlike some other aspects of heart disease that may take years to reverse, this dangerous fat layer can begin shrinking within weeks when you take the right approach. Step 1 is eliminating all industrial seed oils from your diet. This means reading ingredient labels carefully and preparing more meals at home using traditional cooking fats. When dining out, don't hesitate to ask what oils restaurants use for cooking. Your heart health is worth the momentary awkwardness of asking. Step 2 is adopting a low-carbohydrate dietary pattern. This doesn't mean you need to eliminate all carbs, but rather focus on keeping insulin levels stable throughout the day. Prioritize protein, healthy fats, and fiber-rich vegetables while minimizing foods that spike blood sugar. Step 3 involves strategic timing of your meals. Intermittent fasting is one of the most powerful tools for improving insulin sensitivity and reducing epicardial fat. I recommend starting with a simple 16.8 approach, confining your eating to an 8-hour window each day. For most people, this means having your first meal around noon and finishing dinner by 8 p.m. The beauty of intermittent fasting is that it gives your body extended periods without insulin present in the bloodstream. During these fasting periods, your cells become more sensitive to insulin, and your body can access stored fat, including that dangerous epicardial fat, for energy. What's critical to understand is that snacking between meals completely undermines this process. Each time you eat, you trigger an insulin response that interrupts fat burning. The modern notion that we should be eating 5 to 6 small meals per day for metabolism is perhaps one of the most damaging nutritional myths ever perpetuated. Step 4 involves specific types of physical activity. While all exercise is beneficial, high-intensity interval training, HIIT, has been shown to be particularly effective for improving insulin sensitivity and reducing visceral fat. Just 20 to 30 minutes of HIIT 3 times weekly can dramatically improve your metabolic health. What makes HIIT so effective is that it depletes muscle glycogen rapidly, creating a powerful glucose sink that helps clear sugar from your bloodstream without requiring much insulin. It also triggers the release of beneficial myokines, signaling molecules from your muscles that improve insulin sensitivity throughout your body. 5. Amplify your results with these science-backed supplements. While diet, fasting, and exercise form the foundation of your approach, certain supplements can accelerate your progress. Apple cider vinegar, taken before meals, 1 to 2 tablespoons in water, has been shown to reduce post-meal insulin and glucose responses by up to 34%. The acetic acid in vinegar temporarily blocks certain digestive enzymes, slowing carbohydrate absorption and reducing insulin demands. Berberine, a plant compound that's been used in traditional Chinese medicine for centuries, has impressive research behind it. Multiple studies show it can improve insulin sensitivity through multiple mechanisms, including activating an enzyme called AMPK, often called your body's metabolic master switch. Magnesium is another critical supplement since over 80% of Americans are deficient in this mineral. Magnesium plays a key role in insulin signaling, and supplementation has been shown to improve insulin sensitivity in numerous studies. Cold exposure therapy is technically not a supplement, but it deserves mention here. Brief cold exposure, whether through cold showers, ice baths, or cryotherapy, activates brown fat tissue, which helps clear glucose from your bloodstream independent of insulin. Just 2 to 3 minutes of cold exposure daily can improve insulin sensitivity and accelerate the loss of dangerous visceral fat. 6. The transformation timeline. What to expect. When implementing these changes, most people notice significant improvements within the first 2 to 4 weeks. Energy levels stabilize, cravings diminish, and many report their clothes fitting looser, especially around the waistline where visceral fat is most noticeable. Within 3 months, measurable changes in biomarkers typically appear. Triglycerides often drop by 50% or more, HDL cholesterol increases, and inflammatory markers like C-reactive protein decrease. Blood pressure commonly normalizes, sometimes allowing for reduction or elimination of medications. Always under medical supervision, of course. By the 6-month mark, most people see dramatic transformations in body composition, energy levels, and overall health. More importantly, advanced cardiac imaging would typically show significant reduction in epicardial fat, directly reducing your risk of heart attacks and other cardiac events. What's remarkable about addressing the root causes of heart disease, rather than just managing symptoms with medications, is that you don't just improve your cardiovascular health. You simultaneously enhance brain function, balance hormones, improve joint pain, and address dozens of other seemingly unrelated health issues that all stem from the same metabolic dysfunction. 7. Your next steps to heart disease prevention. The information I've shared today challenges much of the conventional wisdom about heart disease prevention. It may contradict what you've heard from mainstream sources for decades, but remember, the conventional approach hasn't reduced heart disease rates. Heart disease remains our #1 killer despite widespread statin use and low-fat dietary advice. If you're ready to take control of your heart health by addressing the true root causes, I invite you to subscribe to the Natural Health Secret channel. Each week, we dive deep into evidence-based strategies for optimizing your health naturally, without relying on pharmaceutical interventions that often treat symptoms while ignoring causes. Hit that subscribe button now, and be sure to tap the notification bell so you don't miss our upcoming video on the 7-day protocol to rapidly improve insulin sensitivity. That video will provide a detailed meal plan, exercise routine, and supplement protocol that works synergistically to reduce dangerous epicardial fat. If this information helped you understand heart disease in a new way, please give this video a thumbs up. Your engagement helps our channel reach more people who need this potentially life-saving information. And remember, your body has an extraordinary capacity to heal when you remove the obstacles to health and provide the right conditions for recovery. The power to transform your cardiovascular health doesn't lie in a prescription bottle. It lies in the daily choices you make about what goes on your plate, how you move your body, and how you manage stress. This is Natural Health Secret Channel, empowering you to take control of your health destiny. See you in the next video.